Hi everyone, and welcome to today's session, which links into the theme of being a healthcare worker in a time of pandemic. As you know, I'm Dr. Nisha Jacob, a public health medicine specialist, and today I'll be talking to Dr. Kate Olmesdah, a second-year medical intern at Victoria Hospital. So our students are currently in the process of returning to the clinical platform, where they may take up learning opportunities in their training to become integrated healthcare professionals. The period of internship is one's first experience of working fully in the services as a healthcare professional. And at the same time, it's still an extended period of learning or apprenticeship, where interns are expected to refine their skills in different rotations under supervision to prepare them for independent practice. So I remember my internship to be a period of great excitement, independence, new experiences, new friends, but also many anxieties when one is thrown into the deep end with expectations to handle challenging situations competently and maturely with often limited support or resources. The current epidemic that we're living through adds a completely unknown dimension to undergraduate training, to internship, and to experiences of healthcare professionals in general. So we thought it would be helpful to hear about a young doctor's experience working at the front line of this pandemic. I'd just like to introduce Kate Olmesdah. Thank you very much for joining us today, Kate. We really appreciate it.
Thanks for having me, Nisha.
Kate, let's just start off with an introduction. Could you just tell us a bit about yourself?
So hi, everybody. My name is Kate. I'm 25. I graduated from UCT at the end of 2018. Oh dear, I need to put my phone on silent. I graduated at the end of 2018, and I grew up in Cape Town, so I'm very lucky to be doing my internship near home. And I have many other interests outside of work, but being a doctor is obviously my passion and pride. And I think just before we continue, I just wanted to say that obviously my experiences that we're going to talk about are unique to me, and it doesn't fully describe what other interns are experiencing across the country, as we all have different backgrounds and hospital experiences. But I hope that I can help a little bit to give you guys an insight into what I've been experiencing.
Thanks, Kate. That's lovely. And that's a very good point that you raise, that different experiences can be varied. And this is just a snapshot of your experience. So, Kate, can you tell us a bit about how your work life has changed since the start of this pandemic?
So initially, it honestly felt like it was this far distant wave that we kind of knew was coming, and we were talking about it, but, there was a lot of laughter around it and ha, 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 when coronavirus comes. And now it feels very serious. And the atmosphere in the hospital has become very serious. And I think what used to be very lighthearted team interactions have become a little bit more guarded, and I think that the atmosphere in the hospital is much more toned down. Everybody kind of feels like they're just going to work and they're going home, which can be challenging at times, because as you said about your own experience in internship, it really is fun. You make so many friends, and yes, it's very stressful and you're exhausted half the time, but you are also having fun and you're learning and you're figuring yourself out. And I think that this COVID time has really impacted that. However, that's not to say that we're not still having fun, because we are, but obviously it's just now in a very different way. It's changed our focus in disease in terms of how we look at our patients and what we are looking for in our patients. It's often basically, are you a respiratory patient, are you not? Whereas we used to use, our proper surgical sieve, and we used to approach our patients from a very kind of clean slate perspective. It's now very much, do I need to worry about coronavirus or not in you? And it's slowly starting to become everybody has coronavirus until proven otherwise. It's also affected our clinics. So obviously we have now closed down most of our clinics except the essential ones. Obviously women don't stop having babies, so obstetrics is still going on. But in the other specialties, we're especially not doing kind of elective work, which I think has definitely changed everything in terms of how the hospital runs. And then it's also changed our priorities at work, because our priority is now about safety over anything else. And as I always say, there's no emergency in a pandemic, and that has definitely changed the way that we approach resources and the way that we approach our patients' care.
All right. That's very interesting, Kate. Can you just maybe describe from a practical point of view a day in the life of an intern like you working in this time of COVID?
So I think, very much like at medical school, you are divided into blocks with internship and you do your various kind of specialty training. But more and more with this COVID pandemic, we are being utilized as generalists. Because in the end, the seniors often view interns as being the people who have an expertise in all the different fields, because we are the ones who go between those departments. And at least once a week now, we are being kind of distributed into the COVID wards. This is at Victoria. Other hospitals are doing different things. But my day typically starts with walking into the hospital, being screened. You have to wear a mask going in. You get screened if you have any symptoms. You get a little piece of paper that says you don't. And then you go upstairs and you don. So immediately, before going into any ward now, you have to get into your PPE, and then you start seeing your patients. But where we used to have kind of teaching in the morning or meetings in the morning, everything has changed because that kind of, those kind of meetings are not encouraged anymore. And other than that, we get on with things, we do our normal work, but there's so many logistical things that have changed throughout the day. If I touch this piece of paper, is it possibly contaminated? Where do I put it? If I've seen this patient and I think they have coronavirus, then what do I do with a folder once they're discharged for 24 hours? So there's lots of day-to-day things that have changed, but the ultimate part of it is that we're still doing calls. We're still following an 8 to 4 day, depending on what department you're in, and certain departments are contributing more to the coronavirus kind of fight than others. And in many ways, it's still medicine. It's still what we've trained for. I still, even though I do have anxiety at times, I still go back to the kind of grounding that we get in medical school. And I think we are prepared for this. We have been dealing with so many things, so many other diseases. And I think I've surprised myself by how quickly my day-to-day kind of routine has adjusted now. And I'm very much comfortable with how things go.
That's really reassuring, Kate. Thank you for that. Something that many of our students are also concerned about, which would impact it in the same way, is that their learning in other disciplines will be impacted and will be inadequate because there's so much focus on COVID. What are your thoughts on that?
I think being a student during a time of disruption, obviously I was one during Fees Must Fall, and I think the 6th year classes has been experienced both now. So, disruption is very unsettling and very scary, and I definitely feel anxious about it sometimes when I think of going into community service and going, do I know how to drip babies now, and I'm going to see them as a community service doctor. But I think it must be remembered that this is now a ripple effect that's happening across all levels. It's not just the students. So they're not going to be viewed as, as less trained because of this situation. If anything, we're all going to be viewed as people who survived through this pandemic and who gave our service during this time. And I think that is actually something to be very proud of. But yes, in terms of teaching and things, I definitely am feeling less of it. I feel like I can manage coronavirus in almost any demographic, but there's certain diseases I don't know about. But in the end, I still maintain that the most important thing you can come out of as an intern, as a student, is being able to identify if somebody is very sick or if somebody is not very sick. And all the other academic kind of details in between, all those kind of intricate learnings, will come later in life if you develop an interest in a specialty. But those fundamental skills of being an intern, of being a young doctor, will be learned. Just now you're going to do it with lots of PPE.
Great. Thanks, Kate. And can you maybe on that note describe whether your interaction with patients has changed now and what impact that's had on you?
Definitely. So I'm a very patient-centered doctor. I love to get to know my patients' families and to interact with the patients and understand, except when they're very annoying, then I don't want to, but it has become very apparent to me that, you know, there's like this you can really feel the different distance between yourself and the patients now, because you are completely covered up. You're very conscious about contact precautions, about distance, and you try to minimize the amount of time that you spend at the bedside of each patient, because as we know, contact is time. And we obviously also need to protect ourselves. So that has been, for me, quite emotionally challenging, especially when you have very sick elderly patients who don't even have cell phones, so they're not contacting their families. We've tried to come up with ways around that, you know, to contact families via cell phones, but it's not the same as speaking to people at the bedside. And you're trying to explain to somebody that their family member is dying, but they can't come and see that person. And that for me has been very difficult. Because I think sometimes people need to be able to see that somebody is very sick in order for them to understand what is actually happening. And I think also, I worry that patients feel neglected because they're not being, that interaction is less as much as it used to be. And I definitely think that our focus is shifted, because it's about protection now more than anything else. Whereas we used to, go really to all extents and levels of care for a patient. It's now, okay, we need to draw a line, at what point, this is now a pandemic, this, nothing can take priority over our own protection. And that's been something that I've really had to grapple with. And it's particularly difficult because a lot of our patients are older. So obviously there are young patients with COVID, but a lot of the patients in our wards at the moment are older and have comorbidities, and it's difficult to see, and it's difficult to not be able to comfort them properly.
Thank you for your honesty in sharing that. It really sounds very intensive. I think, Kate, you mentioned earlier how, the laughter and the sort of fun aspect is sometimes curtailed now. Could you tell us about any change in your interactions with work colleagues?
So we used to, we'd often have team building. So we'd often have lunches together as a department, or we would sometimes even arrange, fun activities outside of the hospital. When, last year we had an end of year function. I don't think that's going to happen this year. So in terms of the social aspect, that's very minimal now. And there's new rules now in terms of the tea rooms, less amount of people in there at a time, distancing between all of us, and it's very small and very important things, but it is changing the way that we're all interacting with each other. But beyond that, beyond the fun social stuff, I think there's also more tension. I do think that there's a sense of, each department feels as though they're really struggling, and then they're trying to help each other, and we're trying to navigate a whole new system because our wards have all changed, and the different departments managing certain cases have changed, and we're all busy trying to construct and learn a new system. But obviously with change comes, difficulties. And I do think that, some colleagues are struggling, and that then also projects outwards in the way that they interact with each other. But at the same time, so that has been hard and exhausting. But at the same time, I think people have also been rising to the challenge, and I think a lot of people are still, they're quite chipper, and as doctors especially, and people in the health profession, we are strong. We're very good at dealing with difficult times, and we're very good at dealing with exhaustion. And I think that the hospital is going to be stronger for it once we do get through all of this.
Thanks, Kate. It's interesting to hear about the changes in the social interactions. We were discussing yesterday how a lot of the exposure that's happened to healthcare workers in the Western Cape has actually been in tea rooms, recreational areas, as opposed to with actual COVID patients. And so it's important to strike that balance with maintaining that camaraderie and, keep building that team, but still having the limits of distancing and all the other precautions, and not to let one's guard down in different spaces away from the actual patient interaction space. So that is very interesting.
Absolutely.
Kate, can you tell us a bit about what it's like working in PPE all day and whether you feel safe and adequately protected?
So it was an adjustment. It was so funny because when all we had to worry about was good old TB, I miss those days. Everybody was kind of like, oh, N95s, and you would wear them if essential, but it was kind of like you were looked at funny if you were wearing an N95 all the time. Whereas now the attitude is completely different. So everybody, you can't go anywhere if you're not wearing the correct PPE, and people will call you out on it. It's a little bit overwhelming in the beginning. The adjustment was quite challenging. And there's a lot of like little things, like, okay, I don, and then what do I do with my cell phone? And then and then where do I put the mask that I was wearing before I put this mask on? And a lot of little things that you have to learn. Wearing the PPE itself, I'm quite used to it now. For the first week, it was very uncomfortable, especially the mask. I don't like that sense of something closed around my face. But now it's starting to just become a part of me, and it's just part of the normal day. I do feel fairly protected. I think that it's unrealistic to go in thinking that you're going to be 100% protected. An error might always be made. Your mask might not be perfect. Like, something could go wrong. And I think that the most important thing that we all need to do for ourselves is to not let that breed too much anxiety. We're doing the very best that we can. I'm feeling very supported by our hospital, and I can only hope that other hospitals across the country are doing as well. And I think one needs to kind of draw a line at how much anxiety you're going to allow this to cause. Because once you're doing everything the way you're supposed to, you just have to trust. And that's the best that we can do. And we just need to be kind to one another and realize that the PPE does have an impact on people. I've definitely, I think I can see the toll that it's taking on everybody, but everybody's also rooting together, and we're in this together. And that's also the other thing, is that we're not alone in going through this. But it does make the place feel a little bit like a war zone, with everybody covered up and dressed up in these kind of like outfits.
Definitely stories to tell in the future one day.
Absolutely.
Kate, can you tell us how this has impacted on your personal, social, or family life?
So I'm very lucky in terms of my family. They are safe and don't have a lot of comorbidities, so I'm not very stressed about them. I think it's something that is universal. Whether you're a doctor or a nurse or somebody who's not even in the health profession, I think everybody is struggling at this time. Personally, I'm actually very grateful for my job, because we are able to get in our cars and go to work, which a lot of people can't do. And I wake up feeling very grateful for that every day. Just being able to drive along the road and be able to look at a different environment than is home. So I think mentally that's been very helpful. And you also go to work and you see your colleagues and often friends and people that you normally wouldn't have the chance to interact with in normal lockdown. But I'm definitely feeling it socially. I don't like this whole Zoom thing and seeing people through a screen. I miss my friends, I really do. And I think what's also important to realize for a lot of the students is, our friends are medics, and our friends are other professionals. And so I may be feeling safe at work, but there's always, at the back of my mind, I'm always a little bit worried about my friends in other hospitals. And I'm always worried, about them. And that's, and then I worry about the greater collective, and definitely about patients. I worry about the average Joe in South Africa who, what they're going through, and people with other diseases who aren't getting the medication that they need or the right kind of care. And then it starts to become very, very challenging for me emotionally. I also feel like we can at least do something. That's been the amazing thing. We get up and we can go to work and we can do something. Whereas I think a lot of people are stuck at home and they're not able to help physically. So as scary as it is going to work sometimes, I'm so grateful for it.
That's really inspiring to hear, Kate. Can you tell us if you've experienced any stigma or perceived stigma for being a healthcare worker?
So I haven't personally. I've obviously gone to the shops once or twice in scrubs, and you see people kind of give you a bit of a wide berth. But I know of a colleague who went to the shops before she went to work. So she was in her scrubs and she got shouted at by somebody saying, you shouldn't be here in your scrubs. No, they might have disease on them. And I think she was really traumatized by it. And I think that there is a fear. And I definitely I'm more conscious of giving people wide berth now whenever I go on a walk or something. Because even though they don't know that I'm a doctor, I feel that weight on my shoulders in terms of, I have been exposed. It might be minimal because of my PPE, but I have been exposed, and I do worry about it. But I still feel an overwhelming sense of support from the general public. Just looking on Facebook, looking, at the shops, I do think that healthcare workers are being supported more than stigmatized. That's my perception, at least.
Yeah, that's great. That's great, Kate. And you did mention before about drawing that line with the fears and anxieties. How do you cope with the fears and anxieties that you and many others describe at this time?
I try and have fun, especially when I start feeling things getting exhausting and start feeling myself get emotional. I just try and take a step back and remember that it's, we still love our work. I'm in pediatrics at the moment, so at least I've got little kitties around me that I can play with. But and then when it does get overwhelming, I cry and I let myself cry, and I think that that's important, and there's no shame in it. And then I get over it. I cry, and then 5-10 minutes later, I get on with things, and I try and do a little bit of yoga or whatever kind of exercisey things people like doing, or eating good food. Nourishing ourselves is very important. I'm very lucky to have a partner who's a good cook. So, and I think just trying to keep perspective and being honest. I think vulnerability is really important in this time. We don't need to pretend to be superheroes. We don't need to pretend that everything is okay. I'm definitely seeing it amongst my colleagues. People are more honest about what they're struggling with. They're stepping up and they're saying, actually, this is really like not a nice time to be working in. And as a group, we'll talk about it. And leaning on each other is really important. And leaning on your friends and leaning on your family and admitting that you're struggling.
Yeah.
That's kind of how I go about it.
Okay. Yeah. I think that support is really important, even though we're distant physically. To reach out to support structures is something really important, and that we must keep building on and not be ashamed of that vulnerability. I think those are really wise words. Thanks for that, Kate. Kate, can you tell us just briefly what inspires you to do your job?
It changed. When I was a student, I kind of just wanted to get to the end, like the OSCEs and the blocks and the exams, and good luck, guys. You're going to get through this, I promise. But then I became a doctor, and I really felt the weight on my shoulders, and I suddenly realized, this is not just a little title. This is a profession, and our decisions have an impact on people's lives. And I think it was just those first few cases and those first few patients when I realized that my caring could make a difference. Some doctors will choose to just ignore it and move on and get on with things. But when you actually take your time to care for a patient properly, it is so rewarding. And that's my motivation. I realize that as scary as this time is for us, it's 10 times more scary for patients, because they are being told that this virus is some terrifying monster, that's coming for them, that's coming for the country. And then they get told that they have it. And I think a lot of them honestly think it's a death sentence. And our job is to make them feel supported and to make them feel like our care is going to help them. That's kind of what just keeps me going, is that I realize that it might be tough for us, but it's probably much, much worse for them to be in this scary place where people are all dressed up funny. They can't interact with their family. They can't have any visitors. They can't have things brought to them. There's a whole bunch of sick people around you, and you're alone. And the least we can do is be there for them.
Yeah. Kate, this has really been truly inspirational and a really wonderful conversation with you. In conclusion, may I ask what advice you have for young doctors and medical students out there?
So I mean, I think the biggest thing is you guys are going to get through this. It gets really exhausting. We were all there, and it feels like a lifetime ago for me, but it's only been a year and a bit. But really, you know, there is a bigger picture out there. So even though it may feel like you're struggling right now with whatever you're studying or whatever exam is coming up, the bigger picture is out there, and you are going to get there. You are going to be a doctor. You are going to graduate. And it's also really nice when you get paid at the end of each month. Sometimes when things are dark and you're just like, okay, my salary's coming, it's a good feeling. But yeah, your perspective is going to change. I think once you are working and once you start realizing your interests and you know your potential, and you start to get to know yourself more as you become a doctor and as you go through, and as you start realizing like how capable you actually are, these things that are causing so much anxiety, like exams and stuff, are going to start seeming a lot less important. And I think just remember to keep your life, you know, balanced. It's obviously almost impossible right now with lockdown, but even if it just means phoning your family, telling your friends that you love them and you support them, like, and eating well. I think, you know, just try and keep a little bit of a grip on reality. And remember that all of us are going through this. It's not just you guys. You're not alone. From professors down to interns, we're all having to wear PPE. We're all having to go through this pandemic, and it is scary. And we're all having to navigate it. And you guys are going to be able to do it as well.
Great. Thanks very much, Kate. And I can vouch for what you said. You know, as you go through that journey of life from internship to community service to registrarship, you know, one gains more and more perspective as we get more life experiences. And then we look back and we realize the profound learning and growth that we've gone through, and how we didn't realize that at that time. So definitely wise words of wisdom there. It's really been a wonderful discussion that we've had today, Kate. You've really outlined what it means to be on the front line of this pandemic from your perspective. And we are really grateful for your time, which is so precious as you straddle between being post-call yesterday and on-call tomorrow. So I know what that feels like. So I'm extremely appreciative of your time. And wish you all the best for the rest of your internship and your career. It's really
Thank you very much.
To talk to passionate, committed and hardworking young professionals like you, because we know that, you know, the future of our society is in good hands when it's so reassuring to speak to people like you. And I know that you will continue to be an asset to your patients and your community. So we wish you all the best. We'll give you an extra clap tonight at 8 o'clock. And stay safe and take care.
Thank you too.
Of you and your colleagues. All right.
Thanks,
Kate. Bye.